Good morning, everybody, and welcome to the Green Social Prescribing session. It's good to see you all this morning. I always like to think that this is the hope we have for the future is in green social prescribing going forward. I'm going to be one of the co-chairs today, and I'm going to share this session with my colleague Michelle Howarth, who is based up in Salford. My name is Richard Kimberlee, and I am a senior research fellow at the University of West of England. I teach public health economics. I'm also the social prescribing regional facilitator in Southwest England for NHS England. I welcome you to our session. I do hope you'll come and chat to us and make this an enjoyable experience. Michelle, would you like to kindly introduce yourself?
Hi, thanks Richard. Yeah, so I'm Michelle Howarth and I'm a senior lecturer in nursing at the University of Salford. I'm also a member of the Social Prescribing Network steering group, and I lead one of the special interest groups that's for nursing, midwives and AHPs, allied health professionals. And I also sit on the Social Farms and Gardens board as a trustee. I just want to say there's a lot of interesting green social prescribing at the minute. I think Nick Gitcham highlighted this in the collaborative leadership panel this morning. Which Richard will allude to shortly, and Jules Ford. But I just wanted to take this moment just to highlight the power of nature in a very different context in nursing, and just read a small quote that was written in the 1800s, which goes like, "I shall never forget the rapture of fever patients over a bunch of brightly coloured flowers. People say that the effect is on the body and the mind, but no such thing, it's on the body as well." Any ideas who said that? 1800s, Crimean War.
The Florence Nightingale.
Florence Nightingale, yeah. Brilliant. And I'm really proud to say that was Florence Nightingale talking about the soldiers that she nursed in the Crimean War. I wanted to mention it to highlight how nature's always been present. It's always influenced the mind and body, and to some degree in nursing. Although we do need to see a resurgence of it massively since they removed flowers from the wards, etc. But I think the impact needs highlighting, and I really hope that this session will help illustrate and generate some good debate about the impact of nature and green prescriptions in particular. So I'm going to hand back over to Richard now, who's going to introduce our first guest.
Okay, thank you very much, Michelle. Karen has asked if you could share that quote with us. We wonder if you could share your room with us as well, because we'd like to see you on the camera as we go forward. People really wouldn't want to see me too much, but they'd probably like to see you a lot more than me. I'm just going to say a few words about what I feel in relation to green social prescribing and where we're at today. And I hope when I say these words, I want you to know that this isn't the point of view of anybody other than myself. And it's not an official point of view from NHS England or the Social Prescribing Network. It's just what I think and what I'm worried and concerned about, but also what I think is the hope in terms of going forward. I grew up in the 60s, and I got vague recollection that some of the young people, and only some of the young people, did make some protest about what the adults had left for them growing up in the post-war world. I just wonder what our children in their 20s and 30s will be saying when they start to think about the world that we've left for them. I think we're living in unprecedented times. Global carbon emissions are now 65% higher than they were in the 1990s. And as this is a result of carbon emissions beginning to create a climate warning, which has led to all sorts of consequences in relation to increased storms, what's alleged to be the sixth mass extinction of species. And one of the facts around climate change is that it enhances the spread of pests that cause life-threatening diseases. Given where we are, Bill Gates, so you probably know Bill Gates, has written in his recent book, How to Avoid a Climate Disaster, that we need to think long and hard about how we try to ensure we reach zero carbon emissions in the future. Gerd Leonhardt, who is a futurologist from Switzerland, and we are an international audience, has talked about We cannot go back to normal. When we had the financial collapse in 2008 and we were reaching negative growth, i.e. we weren't growing, we were trying to get back to normal of doing things in the same old way. To Gerd Leonhard, normal isn't good enough. We have to create together a new normal. The old normal of cars, aeroplanes, fossil fuel consumption, consumerism, waste needs to be replaced by new things, new ideas going forward. And so for him, the old normal wasn't good enough. We have to create a new normal, and that is what the Great Transformation is about. What are we seeing at the moment? Well, we're seeing massive investment into public health in many places around the world, and that includes in the UK in relation to the long-term plan. That's seeing an expansion in the workforce, including social prescribers, but other workers as well, to help deliver change. We see the growth in AI, in artificial intelligence and connectivities between people, which is making sure that we can talk quite rapidly about the threats and the problems that this poses for us. We're also seeing local people begin to plan things better for their own communities, and we've seen that in terms of the voluntary response around COVID-19 and the great work that social prescribing link workers, amongst others, have done to try and help support people living with mental health conditions at this particular time. Gordon Brown was writing last week about the forthcoming 26th United Nations Climate Change Conference, which will happen in Glasgow later this year. The importance of that conference cannot be underestimated in terms of planning to go forward. In this thing, he pointed out that we need to think about four things. And for those of you who don't know who Gordon Brown is, I'm being very UK-centric here, and I do apologise for that. But Gordon Brown is a Scottish Labour left-wing, not too left-wing, politician who was a former Prime Minister of this country. But he was around at one of the first and early global conferences back in 2009. So what he says we need now across the world, in all nation states, is a new Green Deal. A new Green Deal. And we can really see that people are talking about new Green Deals in terms of trying to give extra spending to improve things around our environment and climate change. We need to make sure that there is clearer accounting that private businesses do around their externalities around climate change, fossil fuel consumption, etc. And we need pricing agreements and taxation agreements that will rule out the growth in fossil fuel subsidies. But he said the most important thing that we need is that we need to ensure that we develop big boost nature-based solutions around local communities, around afforestation, to ensure that we begin to build a sustainable future for ourselves. And in many ways, that's where social prescribing is coming to and getting to. I get phone calls quite a lot from GPs. I had one this, well, not phone calls, well, I do get some phone calls, but quite a few texts saying, we want to develop green social prescribing. How do we do it? There is a demand there. The important thing is how we work together to build that. And that's what I hope part of this conversation will be about this morning. So our first presentation, and Jules and Michelle and Alistair and Tim and myself all wanted this to be a chat rather than a formal presentation where you have to click off. But we have got a presentation that's going to be given to us from Jules Ford. Now, I've known Jules for quite a long time. She's the senior lead in the social prescribing team at NHS England and Improvement, and has senior oversight of the Green Social Prescribing Programme. Jules is a registered mental health professional and has many years' experience of both health and in various cross-sector settings, including the voluntary and community sector. Her most recent role was in Gloucestershire Integrated Care System. Now, Gloucestershire, if you don't know it, if you're outside the UK, it is part of the southwest of England. It's a northern bit of the southwest of England region, where she led the commissioning of social prescribing and creative health. Jules lives by the coast in southwest England and is passionate about green social prescribing matters. And that's why her position, her role in trying to encourage the development of green social prescribing becomes very important. So I'd like to ask Michelle if she could kindly put on the link for Jules' video. If you can't, if it doesn't come up, the link is in the meeting chat, which you can access yourself. It was put up about 1 minute ago at 12 minutes past 11.
Hi everyone, I'm Jules Ford and I work in the social prescribing team at NHS England and Improvement, and I am really delighted to be able to tell you about the Green Social Prescribing programme. So I should say from the outset that when I say green, I mean green and blue. So waterways, lakes, our beautiful coasts, they're just as much a part of the programme as our green spaces. The programme's been in development for a couple of years, but as you will all know, it's absolutely of its time. COVID has shone such a light on the importance of connection to nature and our relationship with nature and our mental health and well-being. So the purpose of the programme is to explore how that connection to nature and the activities that go with that can be embedded into local social prescribing schemes and also into mental health services. And that's with an aim of improving our mental health and well-being as early as possible, in reducing health inequalities, so those unfair differences that make an impact on someone's life chances and outcomes, so perhaps income or geography. Reducing demand on the health and social care system, maximising and improving access to green and blue space for everybody, and also understanding how those natural environment organisations who are prescribing and providing green and blue activities can become more resilient and expand. So this is a cross-government partnership, and there are 3 key work streams within the programme. The first is led by NHS England and NHS Improvement, and that is the development of 7 test and learn sites. So those are geographical sites based around integrated care system footprints. So what that means is that the NHS organisations, local authorities, voluntary, community, social enterprise sectors, all working together to understand and implement the programme. The second strand is an evaluation strand, and that's led by DEFRA, Department of Environment, Food and Rural Affairs. And that's a process iterative based evaluation to really understand the complexity and the opportunities and barriers that this programme will highlight. And then the third work stream is led by Department of Health and Social Care, and what they will be doing is working really closely with DEFRA to pull through the insights and understanding in order to understand and align with their policy around mental health and well-being. So in terms of logistics and timescales, we are currently in the scoping phase, and that will roll until the end of this month. So all those 7 sites who've made fantastic applications and gone through a competitive process are now in the process of mobilising their plans and their teams. The evaluation strand has been out to tender and will commence at the end of March. And so the implementation of the programme and the evaluation that will run alongside it will commence in April and will run for the full 2 years. The programme is Treasury funded, so the partners in that collaboration are DEFRA, NHS England and Improvement, Natural England, Public Health England, Sport England, Department of Health and Social Care, the Ministry of Housing, Communities and Local Government, and also NASP, the National Academy for Social Prescribing, very closely involved in the programme. It's a really significant budget of approximately £5.5 million. So a fantastic opportunity to really understand how this might work. So in summary then, those 7 sites are going to test and learn how green and blue social prescribing can be embedded within their local systems, with the aim of understanding barriers and opportunities, which in turn will inform national spread and scale. And the values and the principles of the programme are absolutely about partnership and co-production. So that applies within the systems themselves and with regional support sector partners and also the national partners working together collaboratively. So we are really walking our talk in this programme. We all have different languages and cultures and terminologies, and it's that co-production that is really going to enable us to understand how this can and should embed. So for more information about the project, there will be information uploaded over the coming weeks, and you can find that at on the government website. The link is on the slide. And in the meantime, you could always email us, england.greensocialprescribing@nhs.net. We will be very pleased to give you whatever updates we have as we get them. We're really excited about this programme, and we look forward to updating you in due course. Thank you.
There's been one or two questions in the chat box around the sites, and there's a couple of links that have been put up that will be able to show you where the sites are. Certainly there is one near Michelle up in Manchester, or in the Salford area, and in the West Country, in the southwest England, there is an area around Bristol, North Somerset and South Gloucestershire. So the 7 sites are listed there, but they do represent exciting opportunities in terms of moving forward to try and develop green social prescribing as an offer to local communities, and with the ability to spread that in the hope of more investment into green technologies and a green labour force, the opportunities perhaps could not be well, more hopeful compared to previous years. So if you've got any further questions about that, please pop them in the chat box and we will endeavour to answer that. But now I think it's really time for me to shut up and to move on to our esteemed speakers from around, well, I'm not quite sure where Jill will tell us where she is at the moment, which is in America or Spain, but esteemed speakers, and I'm going to hand over to Michelle to introduce our next speaker. Thank you, Michelle.
Thanks very much, Richard. So it's an absolute delight to welcome Professor Jules Pritty to this session today. Jules is a Professor of Environment and Society at the University of Essex. His full and incredibly impressive biog is available on the social prescribing platform. So without further ado, I'd like to welcome Jules to this session. Over to you, Jules.
Thanks very much, Michelle, and morning, everybody. A little bit of background then around kind of nature and health, setting the scene a little bit, reporting a bit on some recent evaluation and the economic benefits of early treatment and how that fits with a kind of national and international picture, and then a finish on kind of 4 challenges for us all for moving forward. So I think what I'd say to begin with is really that the link between nature and good health, we've been involved in 20 years of research on this at the university. The findings are compelling. There are no counterfactuals. All groups, all social, economic, cultural groups benefit. All environments are good in different kinds of ways, whether high biodiversity or local park or farmland or wilderness. And it's quite clear that nature can act, therefore, as therapy and also as protective. So it can be something that is protective for the future, for longevity, but it's also a context in which we can intervene, hence the idea of the green social prescribing that we're all talking about here. Alongside that, the kind of emergence of a deliberate use of a range of kind of language, partly to medicalize this, but also partly to fit this into the kind of land or conservation arena as well. So we've used the term 10 years ago, the dose of nature, deliberately trying to kind of get into people's minds that we could prescribe a dose of nature in the way that you would prescribe something else, and that might affect uptake and adherence. That we also talk of health services from nature. It's been common in the land and conservation arenas to talk about ecosystem services for the past decade or so, but we can also talk about the health services that we get from nature. Many of us will be familiar with then using terms like ecotherapy. Richard mentioned at the beginning nature-based solutions. Again, a kind of language that may be seen to be slightly instrumental at times, nature-based interventions, nature-based solutions, but actually largely helpful because it sets the context of bringing the natural environment in all its kind of manifestations into the context of thinking about health. So we know that deliberate interventions work. We also know that they're hard to implement, and the kind of challenges around non-communicable diseases and the costs to affluent countries are really substantial. And we haven't made large changes at population level that we could kind of, point towards being successful as interventions. So we're going to need to think about delivery mechanisms. We'll need to think a bit about design of the receiving environments for us, for patients, for the wider public as a whole. And by design here, I mean also access, because this cultural access is just as important as physical access. It's no good just having a park or a common. People have got to feel welcome to go there, and very often they don't, which is why they don't go there. So the kind of cultural context is as important as the instrumental physical nature of the place. An example I commonly use, and I'm sure it will be very apparent to everybody when I mention it, when you think about the design of environments, is think about the difference between a modern hospital and a hospice. Modern hospitals are concerned, of course, with acute treatments, getting people well who are already ill. They're under pressure. If anybody were to say, well, we should just think about, the design of this place on green principles, really, that's at the bottom of anybody's list, especially at this time. And yet, if you walk into a hospice, there's not one that I've been in that hasn't used plants, nature, light, space, meeting places, a sense of kind of calm, a kind of meditative space as much as a curative space as a central part of the principles. Research has shown that east-facing rooms and south-facing rooms in hospitals, wards, on those, people require fewer analgesics and leave hospital on average 2 days sooner than those with different kinds of views. So the view, the light, the context within which we find ourselves, especially as patients, makes a difference to how well we recover. So in a sense, we could say, well, hospitals should be doing it. Well, yeah, they should, but how are we going to get that on the agenda when there are actually at the moment more important things to be concerned about? The prevent to save canon of the Chief Medical Officer of England and Wales was first talked about in 2013, re-emphasised in her annual report in 2019. This was the notion that we should be thinking of health as an asset. Again, I think this will be very familiar to the 100 or so people in this meeting. And it called on ways to slow the demand on the NHS. And again, we've seen in the last year precisely this problem of the flow from population through the pipeline to hospital when we've been thinking about COVID, and how to keep people well or to keep the virus out of people who might then have to present in hospitals. So there's been a lot of interest about slowing that pipeline, keeping people healthy before they have to go to hospital. We know that 15 million people in the UK have long-term health conditions, LTCs, that a half of all GP appointments are LTCs, that 70% of inpatient days in hospitals are LTCs. So people are going around, coming back again and back again. And so quite obviously there's an opportunity there for thinking about intervention to prevent that pipeline flow. So the key paradigm advance is, again, precisely what we're all interested in here, social models of health, how the structures of social, economic and ecological environments matter to us. And we know that, and there've been some really outstanding meta-analyses on these in recent years. Green space reduces mortality, reduces stress, encourages the uptake of physical activity, changes dietary norms, increases longevity. There's a whole range of kind of personal health and community health benefits that flow from the regular access to, and I'm just using the widest sense here, regular green space. We completed, I just got to report briefly on a piece of research that we completed in November, that was published in November, on an evaluation of 3 nature-based interventions and one mind and body one. So these were woodland, garden horticulture, farm walking, Tai Chi evaluations to look at the impact upon populations as a result of those. And we were particularly interested in the UK government introduced in 2013 for the Office of National Statistics, ONS, reports each year on well-being. And there's a single Cantrell measure, 1 to 10 measure of well-being that is now used, and it's kind of a part of the happiness literature, very well established. And we measured the changes on that Cantrell scale from these interventions, these green prescribing interventions. And we also measured the economic consequences of acting early, costs saved, and therefore finances improved. Public finances improved as a result of doing this. On that Cantrell scale, it's super difficult to move 1 point. They tend to be really big life events. The negatives are more easy to measure. Breakup of a long-term partnership, a death, significant personal events result in a 1 point drop. Big positives would be, for example, a baby, having a baby. That's a 1 point increase. So most changes are really quite small at the individual level as well as the population level. It takes quite a lot of effort to shift them. We found on average 1 point increases on this scale for 12 weeks of intervention. And I'm going to come back to this important figure of the interventions must be long enough for people to form habits, to be comfortable with those habits, for neural structure to be changed, and for those habits then to roll forward in the future, because it's not a lot of point making a change, having a spike of benefit and people going back to where they were in the past. And that's going to be one of my challenges. So it is possible to get these 1 point changes. Secondly, we found higher increases after longer interventions. So when people repeating, going back to programs over a 1 year or a 2 year period, they increased over that period of time. Thirdly, we found that 20% of people don't benefit. And actually, this is kind of higher than a lot of social prescribing and IAPT data, which suggests that up to 40% don't benefit from programs. So 20% actually wasn't that bad, but it's worse than 100%. So there's 20% of people are not benefiting. And it would appear to be life events, interventions, things happen to people, stuff happens, people go backwards, fall off the edge of the road into the ditch. It doesn't work for them. So we need to think about how to pick up on those 20% or more of people who fall aside, rather than just reporting on the benefits. If we take out that 20% who didn't finish programs, the well-being scale increases to 1.6 to 1.9. So it really is quite significant, actually, really interesting. Fourthly, we measured the economic benefits created through a number of measures, but I'm just reporting on 2 of them here. One was This was using the Treasury Green Book. This is the UK Treasury Green Book, but also the Manchester New Economy data, which is, I think, pretty well one of the best kind of data sets of public service costs and benefits of actions. And we measured the savings on reductions of GP visits, general practitioner visits, reductions in hospital attendance, and reductions in police incidents. Many of you will know that police are now frontline mental health workers. They haven't been trained for it. They have no idea how to do it, but they are now the front line for a lot of mental health interventions or mental ill health interventions. So we looked at those three. And we also looked at reductions in loneliness through these programs of bringing people together for 12-week periods, for a day a week over that period. And we found that after 1 year, the per person benefits were £1,500 per person, £1,500. Discounted benefits over a 10-year period, which is again what the Treasury Green Book recommends. We measure benefits after 1 year and after 10 years. The benefits after 10 years were £12,000 per person. So when we start to make a case for funding for green social prescribing, we can now begin to say, well, look, it's costing me £200 a person to run this program. But you know what? After 1 year, we're going to create £1,500 worth of public benefit. So there's a case there already for beginning to say what the benefit cost ratios are, how programs could be further funded, how a way of bringing money into that early stage of that pipeline that I mentioned. So I think there's kind of some encouraging stuff around the benefits, the economic benefits created by reducing costs. The challenge is actually making that real money, because if you reduce the costs on the police or on GPs or on hospitals, they're not going to say, that's marvelous, we've now got some free money for you. You can use that to fund your green social prescribing programs. That isn't going to work because they're stressed with financially stressed already. The money has to be found somewhere else. And there are mechanisms, but that requires thinking about. So my final challenges are fourfold. How to turn interventions into habits. We've done quite a lot of work on this. To build a new habit that is sustained over a period of time takes about 50 hours to learn, a minimum of 50 hours of activity. Think about how long it takes to learn to drive a car. And the reason why it's 50 hours, 25 lessons of 2 hours, why it takes that long is you have to form new neural structure in order to make that to use the language here, in order for the habit to be hardwired. So if you just do a short program, people go on a one-day program, it might be nice, might be fun, but there's no going to be significant new habits come from that. So I think we should think about how to make habits permanent. Secondly, following up on negative responders, the people who fall out of programs, who don't respond positively, or other things are happening to them. We need a different kind of program to focus on those. What's plan B for the people who are not benefiting? Thirdly, it's clear from the research that we were doing, and others have said this, that offering a range of options to people is really helpful. So we're not just talking about green activities, but for example, working on diet and food. One of the programs that we evaluated takes people into forests and does a lot of work around cooking and diet and eating in the place. So it's trying to get people to think about food differently. Togetherness, the building of social capital, the nature itself, the physical activity, the personal growth and confidence, all of these are kind of elements of the programs. And to be honest, you can't really separate them. We would say they're part of the green bit of the nature-based solution, but it's social capital, it's human capital, it's a diet in particular. And finally, scaling up. Great if we can make these work for 12 people on a program, fantastic. Great if we can make them work for 1,000 people by an institution, also fantastic. But let me leave one figure for you just to kind of say how poorly one area has been dealt with in the UK, but also in many other affluent countries. 30 years ago in the UK, 1990, kinds of a point that Richard was pointing to earlier on about the carbon changes. 30 years ago, obesity levels in the UK were about 4, 5, 6% of the population. Some suggest it was slightly lower than that. They're now 30%. There's not a single affluent country in the world that has seen obesity levels go up, then reduce them. Some countries have kept them low, Japan and South Korea, 2 to 3% over the whole of that 30-year period. Important stuff about access to nature, around diet, around food systems, around regular physical activity and social capital, all those things I mentioned. But we still have not dealt with these really large so-called non-communicable diseases. So I'd just like to kind of place that thought in the back of all of our minds. As we work on green prescribing, we should be thinking about the big picture of population change, as well as the dozen or 20 or 30 people on a program, or the 1,000 people coming through the door of the GP each year. We should be thinking about, stuff that relates to 20, 30 million people in due course, bigger numbers in some other countries. So that's my bit. Thank you very much for listening. Handing back to Michelle.
Wow, Jules, that was amazing. And I think just looking at the chat box, there's lots of people putting up links to reports. Such passion, such passion. Completely enjoyed and got carried away with everything that you were saying there. I always think it's awful being a presenter that follows you, because it was such an impassioned presentation. Thank you. Wow, I don't think we've got time for Q&A after that. I think what we do is maybe run through and get the Q&A at the end. So I'll hand over to Richard now to introduce our next speaker, Jill. So again, thank you so much, Jules. That was fantastic.
Yeah, thank you, Jules. You have helped to inspire great chat. We should be spending lots of time in chats, but we still got 2 great speakers to come that I know that you'll enjoy. And I'd like to introduce the next speaker. Jill will explain where she is, whether she's in Barcelona or is suffering from jet lag in America. I don't know. But Jill, can you please explain to us, and we welcome you to the Social Prescribing Network. I know that you haven't been able to come here before and you've wanted to come, but thank you for coming and thank you for talking to us. Jill.
Hi, it's a pleasure to be here. I'm Jill Litt and I am based in Barcelona, so I'm here. I have not been able to get back to the United States for quite some time. I do have a prepared presentation that I'm going to try to share. And we practiced before, but it's looking like, let's go to just give me a moment. This is what you wanted to avoid. Okay, I see it. All righty. Michelle, I may have you share.
Right, I'll click on the link and hopefully we'll be able to share. After my gremlins of yesterday, it's saying I need to upgrade my browser. Absolutely typical. Just let me go into your original email, Jill, to see if I can pull it up from there. So it worked earlier.
I know.
Oh, here we go. So I'm hoping I'll share my screen again. I think you probably just have to tell me to move on. So I'll be your less than glamorous assistant. So just let me switch. I don't need to switch anything on other than share screen. So can you see that, Jill?
Yes.
Brilliant. All right. So just let me know when you want me to move on.
Okay. Well, so it's a pleasure to be here. I am an associated researcher at IS Global. I'm so pleased to be a part of the panel. Thank you, Michelle and Richard, for the invitation to join you today. Very tough act to follow, but I'm looking forward to telling you a little bit about my work and the work of a newly funded H2020 project on nature-based social prescribing. So you can advance the slide. So I start with one of these questions. this main question, which is which one of these is considered a legitimate health expenditure to address population mental health conditions and why? And you could take this picture with the blue pills and you could put dialysis in there, you could put chemotherapy in there, but the fact remains that we lean towards these treatment-oriented approaches to addressing chronic diseases and to addressing mental health. And so you can go to the next slide. There are thousands of studies, as Jules talked about in the previous presentation, and it goes like something like reading from a script, nature contact, time outdoors is associated with. And there are scores and scores of outcomes from chronic disease to mental health to social processes, obesity, stress, anxiety, inflammation, general outlook, physical activity, diet, microbiome changes, social life. Why, the question is, do we still kind of contemplate this? What I hear from this conference is actually the UK is accepting the evidence and starting to incorporate it into practice. But from a North American perspective, or at least from the United States, this isn't the case. There's still this bring me the evidence, show me the evidence. And the studies are different. There's all kinds of studies. There's fewer on the clinical trial side, more on observational studies, more on qualitative research. But when you look at the body of evidence, it all points to the same thing. Next slide, Michelle. And when you ask people like gardeners why they garden, so you start to contextualize the quantitative findings, it's always the same response. I do it because I like to get my hands dirty and feel the earth. I do it because it makes me feel good. I do it because it gives me an opportunity to spend time outdoors. I do it because I get to connect with others. This is stealth health. This is not in your face. I do it because I want to eat better. I do it because I want to increase my minutes of moderate to vigorous physical activity. This is because they do it because it hits them somewhere deep inside their emotional connection, their social connection, and just a feeling. But that's the pathway to change. So we need interventions that strike at these kinds of emotional connections that people have, because we know in the social psychology literature that when you start to intervene early and you start to intervene in these very early psychosocial processes, the likelihood and being intrinsically motivated, the likelihood for change happening and sustaining is much greater. Next slide. We've gathered, the teacher in all of this for us is the garden. We have used it as a model system to understand how behavior change happens when people connect with landscapes. The interesting thing about gardens, and there's a lot of sort of skepticism I find in the scientific community, not our community, but if you go outside of this into traditional medicine and public health, is that, oh, it's a site, it's a program, it's a thing that people do when they have money and they're, have time on their hands, and it's very exclusive and it's just a couple people. But I kind of flip this thinking to say, well, these are nodes in these complicated urban networks of communities. And when you start to increase these nodes and you activate them with these kinds of interventions and changes, you start to have more, that change starts to be more contagious and the effects of it start to spread. In Denver, where I've done most of my research through the University of Colorado, there were 40 gardens when I started. There are over 180 now, and that's over a period of a decade. So it started small, it's spreading, and now it's sort of, there's a wait list in every garden. The other beautiful thing about gardens is that they grow organically, excuse the pun. You can find them wherever you go throughout the world. And that story of the reasons why people garden, it doesn't change no matter what part of the world you're in. You can do it with all your skills, your culture, with whomever. You could do it alone, but you're side by side. It fits many different contexts. Next slide, please. So we've taken all of these research over the past 15 years or so, and we've put together this conceptualization of how we think this works. And what's critical here is that it's garden in that green box. It could be any other socio-environmental intervention. But what's critical is that there's a social organization. There's direct and active participation. So it's tactile, it's emotional. There's an aesthetic, igniting of experiences and feelings. These are the things that start to change. And when you start to change this, you start to tap into a whole array of outcomes, health behaviors, chronic health conditions, inflammation, and also the mental health side of it. Next slide. We have been working on this for a while. There's a question of, at what point do we have enough evidence? I can relate to you a very short story that I was with a funder of a very large national foundation in the United States that specializes in food. And I hadn't even really opened my mouth, and the funder said, oh gosh, please don't come to me and talk to me about gardens. So there was just this feeling, this guffaw, like, I can't take another proposal about gardens. And it made me pretty sad, because I thought, why are our national leaders who are guiding our national research agenda not taking this seriously when we have all this evidence, but it wasn't enough? So we took it further. We went to the American Cancer Society. We had a very successful proposal. And in 2016, we found out that we were going to receive this large research grant to run a randomized controlled trial of gardening. Next slide, please. I won't, unfortunately, have time to go into the results. We are finished with the trial. I can report to you that it was successful. We had an 80% retention rate. We had 300 participants who stayed with the entire intervention over 1 year. We did have that long period to observe people, and then we had a follow-up period. We looked at the traditional outcomes that the Cancer Society was interested in on health behaviors like diet and physical activity, but we also made a commitment to really look at the mental health conditions. We looked at stress, anxiety, and general well-being. Results are coming out. The trial was successful on all our outcomes. Stay tuned for summer 2021, hopefully, when our results will be out in circulation. Next slide, please. So I come back to this image and I say, well, will more clinical and pragmatic trials tip the balance so that we can focus on these sensible, affordable, sustainable, and scalable interventions? I don't know. I really hope that someday I can go back to the foundation, the same person, and have this discussion, and I'll tell you. But we keep moving forward with the science and strengthening the evidence so that we don't constantly have to be having this debate or trying to push our agenda without the evidence to back it up. But I also don't know if it's really the solution, because why are we held to the same clinical standard approach? Like, this is the only way we're sort of able to review the evidence to say if something's successful or not, and we're ignoring that maybe it's a more holistic approach to demonstrating impact through these alternative interventions. Next slide, please. So we continue. Now, one thing I want to recognize is that gardens are not for everyone, but the ingredients of gardening is something that we can replicate in using other kinds of nature-based, outdoor-based activities. So Reset This, I introduce you to it, reimagining environments for connection and engagement, testing actions for social prescribing in natural spaces. Next slide. And this is an H2020 project. We found out we were funded in October, and this week, March 1, launches the official start of our study. It is part of this Innovation Actions for Improving Urban Health and Well-being. And I'll tell you just a little bit about the study. Next slide. This is the model. I don't have time to go through it, but just to show you sort of the theory of how we think this fits together, the kinds of outcomes we'll be looking at. And because you have these slides, you'll be able to look at it more closely. Next slide. But just to show you just briefly, there's many elements to the study. One of the elements, one of our work packages will focus on 6 studies. 3 of them will be randomized controlled trials, 3 will be observational studies, and the reason for the different designs is just the readiness of communities and where people were at when we designed this project. We will test whether the intervention of nature-based social prescribing reduces feelings of loneliness and social isolation. 6 cities will deliver the intervention: Melbourne, Marseille, Barcelona, Helsinki, Prague, and Cuenca. And we will recruit from clinical and non-clinical settings with the goal of 250 participants per city. Next slide. Just a call out to our partners in Marseille, Prague, Helsinki, Cuenca, Barcelona, and Melbourne. Also, Richard Kimberlee is a partner on this grant to help us kind of build out the social impacts assessment. We have partners in Australia who will also work with Richard on studying the cost effectiveness and health impacts in general. And then the other piece I wanted to mention was that we have a social network analysis built into this to understand the ecosystem of players working at the intersection of nature and well-being, and in a position to help us kind of move nature-based social prescribing forward. So it's a call out to this group to say we'd love to partner. I think the timing is incredible with the DEFRA funding, that we have these partnerships and have some synergy across the different initiatives. Next slide. And that's it. So thank you so much. I look forward to more discussion.
Thanks, Jill. That was an excellent presentation, and again, it's showing us the hope for the future of where we're going to, and knowing that, you know, green initiatives are happening all the way around Europe and the world, and it's exciting to know more about it. People are asking, they want to know more about the initiative, and I've just popped into the chat box a link to the details about the study that's starting in April. It's going to help to expand and broaden their knowledge in a co-produced way with local communities to ensure that green social prescribing becomes the way of life. But I think we need to move on. I wish we could have about another hour on this, to be honest. But Michelle, would you very kindly introduce our final speaker today? And if we got chance, I know a couple of people got hands up, and we'll take the questions at the end if I can find out who they are.
Thanks, Richard. So again, I'm absolutely delighted to welcome Professor Alistair Griffiths, who's the Science Director of the RHS. So he's responsible for managing the RHS team of scientists. He sits on the RHS Exec Board. A highly skilled team of scientists. I've always called Aleister a walking library of everything that is around nature-based interventions and the impact. He's responsible for ensuring that the RHS charity remains at the forefront of horticultural science. He loves to inspire, motivate and engage people about the role of gardens and gardening, particularly around horticulture and the benefits for the environment. I personally have Alistair's ambition, which is to build a more resilient gardening community who enjoy their gardens and who take positive action to benefit their gardening handprint on the planet to maximise the health of our nation. I think what an ambition. I've got some slides to share. So without further ado, welcome Alistair, and I'll share my slides now. Just give me a minute. Is everybody able to see? Actually brings up the next slide. Hang on a second. It's probably better like that if I just make it bigger. Is that okay for everybody?
That looks good, Michelle.
Okay, thanks.
Michelle, there are some animations, so it might not necessarily.
Oh, right, okay. Let me share the other screen then. I know exactly where I've gone wrong with this. So just give me a second. There's a knack to this when you've got two screens. There's a knack to it, and I can't remember how it was done last time. I think let's try that.
Right.
Yeah, we'll just have to go with that. Is that okay, Alistair?
Yeah, that's fine. Thank you very much, Michelle, for inviting me. Michelle and I had a number of conversations, got very excited about the whole aspect of gardening. In fact, gardening has helped me a huge amount over my life. So I directly saw it, and I've always been passionate since the age of 4. And if you go on to the next slide, please. I think one of the challenges that we have first, and we still do first, is this philosophical challenge that Wondersley and Aleister talked about, which is plant blindness. So I think there's still a huge amount of people who really just don't understand plants and don't understand how important they are to us, to our lives, not just by bringing the sheer joy and pleasure of it, of nurture, but also, you know, the aspects of all the benefits that they provide us from an environmental and a social being. So next slide, please. And when we talk about this movement of of millions of people, well, yes, we should think about nature, parks, gardens, whatever green stuff, is really important and can help. But there are 30 million gardeners in this country. So that's the millions that we can tap into. 1 in 2 people actively garden. So that's 50% of the population. There's 700,000 hectares of garden in the UK, and 29.5% of urban areas is domestic garden. So not only that, but the Oxford Economic report that was just produced recently, the horticultural industry and the landscaping industry and those that deliver the services for this natural preventive healthcare provides 24.2 billion national GDP per year to the economy, and there's much more room to grow. So we must remember, and I think it kind of is bizarre that we will spend, and it's important we spend this on species, but the orangutans and pandas, we spend millions of or hundreds of thousands of pounds protecting these animals and their species, yet we do the reverse in cities. We spend the same amount of money destroying our habitats, and therefore is it any wonder why these green spaces that we have, there's some very positive things that are going on now, but that actually we're creating an issue here. So can you move on to the next slide? This one was basically what it shows. This graph is the evidence of dosage of basically the increased effect on medical outcomes of nature deprivation. So the more nature deprivation you have, and you can see the depression and anxiety elements. But as previous speakers have shown, there is increasing evidence of health benefits of gardening. There is actually increasing numbers of doctors prescribing gardening, and there are more and more increasing number of social prescribing gardening groups. And yesterday, I saw a couple on the awards, the gardening, the cacti, the food production doing great things. So if you move on to the next one. So, and there is some theoretical aspects that underpin a lot of this stuff. So these are some of the main ones. I do love the element of flow, because when certainly, I don't know how many of you, if you are gardeners and you go in your garden, how much you lose track of time. And, when you are weeding, it's a focused mental state, and it does take you into some kind of element of mindfulness session. Okay, next slide. But physical health also is linked in relation to this. So if you go on to the sort of next slide, what I did is I basically pulled out the Harvard Medical School data in relation to calories burned per 30-minute activity. And when you do activity, you trigger physiological aspects in the mind as well, which helps to boost serotonin as well. So you can see that, these different activities and gardening within them can play quite a significant role around the physical health aspects of it. And also, in respect to that, and again, speakers have talked about this, but the nutritional benefits and the diet elements, knowing what you've grown, how you grow it, and the different types of varieties within the UK. So for example, there are 400,000 different types of garden plants in the UK, which we can look upon and look at how we can best optimize their nutritional benefits for well-being. So next slide, please. And social health linked to the sort of well-guided soul. Just recently, there has been quite a big randomized trial piece of research that got 541 vacant lots. It was a randomized control, and they increased those plots with vegetation. And what they found was not only a perceived report on reduction in violence, crime, and fear, but also an actual reduction in violence, crime, and fear. So again, linking back to some of the stuff that Jules said, that removes some of the issues, and it creates a sense of place, a sense of community, particularly around the isolation of people. It goes without saying, the more connected you are with people, the more likelihood you'll have a friend to lean on, or they'll support you. And again, I can't think of anything more powerful than gardening as being a social connector and reducing the social equity gap between people, because you know, it could be someone who's very, very wealthy, but they may love a snowdrop, as well as someone else who has no money at all, but still will love a snowdrop. It's that natural connection with nature and that sense of enjoyment. So it's improving that sense of pride and place. And we just recently, Laurianne Shalmin-Pugh, who's a wellbeing fellow at RHS, and Ross Cameron, Sheffield University, we've just published in Cities sort of what gardeners feel and perceive. And it was a survey of about 5,000, just over 5,000 people. And the key driver for a lot of people in the top three was the joy and pleasure that they get from gardening. Number three was health. But again, going back to the last speaker, this joy element, tapping into that emotional connection is how perhaps we can get towards a behavioural change. Okay, next slide, please. And I'm just going to give you some case studies that we've been involved in. So spending your time, and this was linked to the Mene survey. This is Exeter Peninsula Medical School, Rebecca Lavelle, and Mene working with Natural England and the RHS. And basically what we reported out of this survey of 7,814 people is that gardening and using gardening reported better health and well-being, more physical activity, and more nature visits than those who didn't have a garden or have a green space. And this includes balconies and yards. So I think there is an element whereby in planning and designing, we should be saying that every home in the future, or every space, every balcony, every flat should have a room for green space and plants, be it either indoor or out, be it either a tiny plant pot or you know, a certain amount of space. Because, you know, looking at that compared to no garden access and access to private garden, it's associated with better evaluative well-being. And so I think no matter say how big or small, I think, you know, there's benefits there. So next slide. And the second project that we were involved in, again with Sheffield University, but we also had, which was really exciting, I felt, support from social housing in Salford and Greater Manchester. So basically what we did is we greened up a street in Salford and had controls, and United Utilities as well, a water company said. And what we did is we measured perceived stress scale, and we saw a 6% decrease in those that had 2 tiny containers in a tree in their street compared to those that didn't have. Now that's equivalent to 8 weekly mindfulness sessions. And then what we also found was that there were healthier cortisol patterns, so from 24% of that population to 53. So direct physiological measurements. And there are other studies, certainly in the Netherlands, about gardening and cortisol profiles, and also in Edinburgh, linked to vegetation, linked to green spaces, showing that there is physiological differences. But not only those measurements, the power of the qualitative elements of how, you know, one of the people in the street, for example, became a street champion and wanted to make it better. So it really is transforming people's lives and bringing connectivity. People who never talked to each other, had the same tree in the garden, went, oh, you've got the same tree as me. It started to connect the community together. And even more so, the fact that they're in front gardens, yes, they're private, but they're also that interface, that cross between private and public. So you could be completely 2 different people with 2 different complete backgrounds, but you can both appreciate what's in that front garden and have a connection, building that resilient community. Next slide, please. And some of the things that they said in relation to what that plant, the front garden, it made 52% happier, 40% more relaxed, and closer to nature. Okay, so moving on to the next slide, please. This was a study I was lucky enough to work with Michelle Howarth on. This mainly was linked to the RHS Bridgewater Garden pilot study. So what we did here is we basically have designed a therapeutic garden at Bridgewater Garden. It's a new RHS garden which will be opening soon. And we worked with Michelle, and we looked at how we could have a pilot study in relation to a small number of people. And certainly some of the key aspects of this, well, you know, nature-based social prescriptions did have a positive effect on that, and you can see the shift of before intervention to after intervention, how there was a shift from a 20% shift from low well-being upwards and more, upward shift. But I think what this kind of gives is that social prescribing does enable personalised care for people living in the community, and that nature-based solutions, and again, it is bizarre that we're still having to say these things when the science is there, that nature-based solutions such as gardening help improve well-being as part of social prescription. But also what Michelle kind of opened my eyes to was that community nurses are ideally placed to work alongside link workers and the voluntary sector like ours and community and social enterprise sectors to facilitate social prescriptions and support this community resilience. So next slide, please. And, without a doubt, COVID-19 in many ways has been very, very tragic, and each of us have probably been impacted upon it directly or indirectly. But what it has also shown is that where have people gone to for solace, for relief of anxiety and mental health? Well, they've moved towards nature. They've moved towards spaces. And, one thing I do really, I adore Nigel Crisp, who was the ex-chief executive of the NHS. And he wrote a really good book, which is called Health is at Home, Hospitals are for Repair. And I do think this nature preventative healthcare stuff is really, really critical, no matter where it's done, no matter what green space. It's the activity of doing it and having plants, people and places together. Now, there's a couple of COVID-19 studies here, and again, I just thought it'd be interesting to sort of share these. Some of these haven't been published, but are available. So the University College of London made me laugh a little bit in that there was over 55,000 adults who have been on a long-term survey linked to the impact of COVID, and they looked at time use and mental health. And what they came out with is that if you did 2.5 hours of gardening, it improved your mental health. However, if you watched 2.5 hours of the news, it decreased your mental health. So I thought that was it was quite interesting. So I've stopped watching the news and I'm out gardening. And the other thing we did is we did an RHS survey in Moripole, and we hope to produce some of the results linked to that. But it was 2,000 people, so it was a small population, but it was representative. 71% of them said that the garden helped with their mental health during lockdown, and 60% said that gardening helped their physical health. So I just wanted to get an understanding of what our staff at the RHS did. So we have about 1,000 staff, and about 800 people answered a similar question. And it was quite interesting that 74.2% had said that their garden had helped them during lockdown with their mental health, and 61.1% had helped with their physical health. So quite similar aspects. And just this week, just so that you're aware what is happening, certainly is this this gardening, people going and doing and growing, is that just this week, our advisory, the RHS is an advisory service for our members. Online, we were 203% up last week, helping people to garden. The telephone was 150% up. So we can use gardeners as a vehicle for that change, because they're connected to nature on their doorsteps. They can grow food and understand some of the issues. And we can widen that to the wider public areas around those that can't have a garden, but we should push planning to put gardens in, even if they're small or a small growing space, even if they're containers. So next slide, please. Because the well-gardened mind, body and soul, as well as the well-gardened environment, which is our handprint, means that we have all these things that mean social prescribing, the design of the garden, what we put in our garden, and the activities that we do will help with healthy people, plants, places and planet. And that isn't cheesy stuff, that is reality. We've got a climate and biodiversity crisis. Something that's really exciting, I think, if you haven't seen it, is Das Gupta's review, which is saying no longer is our economic model correct. and we should look at how we best shift that model. And thankfully, nature-based solutions are put within there as part of the solution. Unfortunately, but it is in there in relation to the health aspects, which is good. Gardening is in there, but again, gardening in relation to its soil, in relation to its flooding, in relation to its cooling, in relation to its noise reduction, in relation to pollution reduction, the nature-based capital that provides on people's doorsteps is phenomenal. Not only in the private space, 60% of gardens have a tree, but also for the public space. So that's me done.
Thanks, Alistair. That was absolutely fantastic. Again, what a range of presenters today, and totally amazing. A real good mix of the science base, what's out there, qualitative and quantitative data. I'm just blown away with all the speakers today, and what a brilliant way to have all these sessions on a Friday. Makes you feel good for the weekend, makes you want to get outside, doesn't it? I love the idea of social health, the well garden, mind, body and soul. I'm gonna use that little strap line in quite a few things, so I'm gonna steal that, I'm afraid. So right, I'll hand over to Richard now. Richard, I have to co-chair another session. It's the Greater Manchester thing, so
I think we're just about to be kicked out. I think we're just about to be kicked out anyway. We seem to have been running out of time with all these wonderful ideas. Well, I know that Sue Kett had her hand up for a long time. If we can get Sue's question in, if she wants to unmute herself and ask a question, but I've just been inspired so much listening to all the things today. Somebody's just said they're going off now to weed their ponds. So we're having practical results in people's lives, and that is what social prescribing is for all of us to do everything, particularly around nature-based things. But I'd like to thank all the speakers. Tim sends his apologies. He'll be talking about similar issues right at the end in the final session of the conference. He'll be reflecting on what we talked about today and hopefully inspire us to deliver a great future post-COVID, or a different future, not going back to the past, creating a new normal. Thank you, everybody.
Thank you.
So we're still here. If anybody wants to ask any of the speakers a question, Jules had to go. We'll try and take a couple if you want to, but why not go outside and enjoy the green world?
Richard, are you okay if I disappear to the other co-chair session? It's the Greater Manchester Showcase, so I'll have to disappear. Thank you, presenters. That was phenomenal. Absolutely love that.
Great, a lot of fun. Excellent, really nice.
Thanks. It was good fun.
Thank you, everybody.